Hello everyone, my name is Rachel Mary Guy, and I wanted to encourage every single physician who may be watching this. You all are truly my heart and soul. Truly, yes, I've been involved in the pro-life movement, and yes, I have a heart for every single aspect of the pro-life movement, of PRC work, etc. But what really burdens my heart are, first off, seeing that every single preborn child is cherished and is valued and is never aborted, and also to see the medical community understand this truth. I want to encourage every single physician that may be watching this to know something. If you are going to be 100% pro-life OBGYN or MFM, maternal fetal medicine specialist, I want you to not believe the lie of the following. Please do not believe that someone should abort their baby because their baby has a health condition, anencephaly, maybe Down syndrome, trisomy 13, trisomy 18, etc. Please do not believe that we should be aborting babies because of a poor prenatal diagnosis. Each child is made in the image of God. Each child is a valuable person. And I think about Dr. John Berchowski, a friend of mine. He has a powerful testimony. He's actually a former abortionist. And in his book, he had said in summary that a child does not become their diagnosis. Isn't that true? It's so true. I want you to think about in other fields of medicine. Let's say an oncologist, they're with a patient, they find out this patient has cancer. Does this patient become their cancer? No. Does someone become their brain bleed? No. Does someone become their diagnosis? No. They are still the person that they are. So please know this and have it be a part of you that is so ingrained in your soul that you do not refer for abortion, that you do not tell a parent, which I heard heartbreakingly, that this physician felt like he should give options to his patients and that the options were abortion or or a plan of how to help this precious child, like just once they're born. Abortion isn't an option. It's not an option. Please do not believe the lie of saying, well, I would not personally perform an abortion, but I can refer you to have an abortion. I can write down the abortion location's address and give it to you. Please do not believe that. Please do not. As a pro-life doctor, you have the most extraordinary opportunity to be 100% pro-life. I don't believe that you can call yourself a pro-life doctor and refer for abortion. I don't believe that you can be a pro-life doctor and say, well, I'm going to give them their options. No. When a woman finds out she has a poor prenatal diagnosis, you do not tell her that she can abort. You do not tell her where to abort. And you do not tell her that she should abort, and you do not tell her that she can abort. Abortion has no place in medicine and has no place in society and has no place at all on this planet. I think that in our nation, in our country, and in medicine, the word abortion has simply become a word. The reality of what it is has not sunk into the hearts of every single soul. Even some in medicine who they say they're a pro-life doctor. What is abortion? Abortion is the preemptive killing of a child. So I want to kind of put this into the context for just to kind of help you wrap your mind around how odd, how ludicrous it sounds when someone's saying they're a pro-life doctor and they're saying, but I make exceptions, but I want to give them their quote-unquote options. Okay, so let's go through it. So let's say a young woman, she finds out that her baby has a poor prenatal diagnosis, and you're saying you're going to give them the options. Okay, so you're saying option 1, abortion. Option 2, carry to term. Option 3, let's see how we can kind of like come up like just with a plan for this little one, whether it be comfort care, whether it be intervention. Now let's go back and let's say that again. So the list, but let's say not the word abortion, but what it is. So, hi, I'm a pro-life doctor, and I'm going to give you your options because your baby has a poor prenatal diagnosis. 1, you can kill your baby. 2, you can keep your baby. 3, you can keep your baby, do comfort care, keep your baby, and do intervention. That's absolutely wrong and insane. The killing of a child is no place in medicine. The killing of a child is no place in the world. We need to be fighting for every single preborn child, never believing that abortion is justifiable. As a physician, you have a duty and a responsibility to care for the preborn child, to care for their mother. And to care for a mother is never to tell her she can kill her baby. Being able to do something doesn't mean it should be done. I pray that any doctor that watches this knows you need to fight for these preborn babies. This child inside of the womb is your patient. They're not the second patient, but first the mother is the patient. They're both. And I think about how Dr. Lyle and Dr. Berchelski talk about this. Both are the patient. Use your voice for the Lord and for life. Life is never killing someone. Life is never thinking that you can believe that abortion is an option. To end in a quote, as Lila Rose says, women deserve better than abortion. Yes, they do. And women deserve better than to have a medical community that believes that killing a child is acceptable, is health care. That killing a child should be quote unquote acceptable for certain situations. A person is a person, no matter how small. Dr. Seuss.